Good
Sir,
evening, everybody.
sir,
Yeah,
yeah.
good evening, everybody. And I'm very sorry that we are actually 15 minutes delayed. So we are not going to take much time. But what I want to say that as Indrila is mentioning, and also in the flyer, this title identified by the department is really a very interesting one. And this, I'm sure the topic itself is one of the topic why today's pandemic demands the whole thing. So the healthcare management in the post-pandemic environment is one of the most important things. Now, what I think that the COVID-19 pandemic acts as a transformation catalyst, which accelerating the implementation and adoptions of changes in the public health interventions. So a new model of healthcare delivery emerges with more emphasis on preventive measures, remote care, and substantial technological dependence. However, these are juxtaposed against ongoing technical challenges to meet the surge capacity in the laboratory testing, the fast-tracked implementation of new technologies, the mental health concerns, the ethical concerns on the potential rationing of insufficient resources, and the protection of privacy and personal data during times of crisis. So there are several aspects which are emerging as most effective in the post-COVID-19 era where the healthcare management can play a very important role. Now, today, I really want to thank the Dean of the Department of Business Management, Professor Ratan Khashnobish, for spearheading this talkathon along with his team members, Madam Bush, who is instrumental in supporting the whole activity with respect to the Industry Connect. I'm very happy to find out that two eminent personalities are going to join us today. Dr. Alok Roy and Mr. Rupak Barua. Both of them are from two hospitals which played a very important role during the last 1 year in tackling this pandemic situation. With these few words, wishing a great success for this talkathon, I wanted to end my lecture. Thank you. Namaskar.
Who is coordinating now? Since Professor
Now,
Shantanu Rai,
I shall request
uh,
Professor Ratan Khashnobish to say a few words before we move on to Shantanu Roy to introduce our Dr. Alok Roy, our first speaker.
thank you, Professor Vice Chancellor Sir, and Professor Shantanu Rai, are you here? Professor Rai or
He
Professor
is
Dotto
here,
must
but
be
he's
here.
not
Professor Dotto is
responding.
here.
Yeah,
And the
yeah.
audience. On behalf of the Department of Business Management, I really welcome you to this webinar seminar. This seminar has been inaugurated by our Vice Chancellor, and at the first part of this thing, I shall briefly present the issue to you. Out of this, as it was planned, Professor Shantanu Rai will take some clue and will act as the rapporteur of the session on which our respected speakers, two speakers we have, they will make their presentations. I tell you, I am not concentrating on healthcare industry as such. Healthcare industry has three aspects. One, clinical services. Secondly, manufacturing of drugs and medical equipments. And thirdly, the support services. In this presentation, I shall concentrate on a particular aspect or particular part of healthcare industry, that is on healthcare services comprising of primary care, secondary care, tertiary and quaternary care. Primary and secondary level care, as we all know, are taken care of without hospitalization. Hospital actually comes in the scenario at the tertiary level when you need higher level of care, and that higher level of care is actually presented by the hospitals. So if I start in this way, within the healthcare industry, there is a segment which is called healthcare services. Within that segment, healthcare services, there is a finer part, tertiary care, where this hospitalization part actually appears. I would tell you that the size of the hospital industry in India is increasing at a mind-boggling rate. In 2017, the market of hospital industry had been as big as 4 trillion rupees. I repeat, in 17 it was 4 trillion rupees market. And under the existing scenario event, by 2022, it is expected to increase to 8.6 trillion rupees market. That is compounded annual average rate of growth at this phase is 16 to 17%. It is not with respect to the primary care, not with respect to the secondary care, but with respect to the tertiary and above hospital. It is increasing like anything from 4 trillion rupees. The size of the market is now at the level of, I would not be surprised if in 2021 the size of the market is found to be somewhere near 7 trillion rupees, because by 2022 it is expected to be a market of 8.66 trillion rupees. So this is where the hospital industry stands. And if it is so, that is, if it expands in this way, then from business point of view, we should ask a question. Is the industry in India, I mean the hospital industry in India, is at the early phase? Is it at the innovative phase? Or is it approaching the maturity phase? I think signs are there since the size of the Indian economy since compared to what we have as our Indian economy, the size of the Indian economy, the possibility of expansion of this hospitality industry is limited by what is there in Indian economy. Possibly we have crossed the early phase of hospitality industry. Possibly we have crossed the innovative phase. Possibly we are we're trying to achieve, we are at the level of achieving the maturity phase. At the maturity phase, an industry actually concentrates on the competitors, concentrate on certain key products, and they try to gain by economy of scale. And since the small players are no longer in the market, instead of increasing the scope of business, they focus on a particular share and cash flow. This is sine qua non of industry achieving the maturity level. Hospital industry, I understand, is achieving this maturity level. Now, if this is so, we are at the level of maturity so far as the hospital industry is concerned.
Hello.
Then pandemic has actually changed the scenario. The pandemic changed the scenario in a way that you cannot settle for your key products. AMRI cannot now sell only something related to, say, gastroenterology. AMRI shall have to go for selling something which is related to the pandemic. you cannot concentrate on your key products, you cannot actually drive out the competitors, and it is such a situation where market is over expanding and therefore the quality may be compromised. If this is so, then the scenario, I think, from the point of view of business in the pandemic, when you are not concentrating on your key products, actually you are moving back to a level, the early phase, when innovation is welcome, new products could come in the market, and you are trying to increase your market share. Such a scenario can develop, and it might be difficult to get back your key products, the key products on which you are concentrating. And therefore, as I understand, if the hospital industry is coming at the maturity level and hospitals which are existing are concentrating on the key products, pandemic has brought a challenge to them. Challenge in the sense that they cannot concentrate on the key products. As they cannot concentrate on the key products, actually the scenario is wide open where so many challenges will come, and the nature of such challenges possibly Mr. Barua and others better knows. And I would leave here to learn from them what challenges they are facing at the stage of the pandemic. I would stop here just by noting the fact that if you concentrate on the key products at the maturity level, pandemic has changed the scenario. And how you are facing this particular situation, this we would like to know from you. With these words, I would invite Professor Shantunura. Are you here?
Yes, yes, I am. But my
Ah, so
somehow or other my video is
would you please take up without wasting time?
yes, yes.
Okay.
Good
Thank you.
evening.
Thank you. Thank you.
Good evening, and good evening, VC sir, and good evening, Professor Kashnavish, and my dear friends Rupak and Alok. Let me first of all apologize. There is something basically wrong with this Zoom. I have been doing so many seminars. Last year, the entire CEO's conclave we did on Google Meet, which was organized by the School of Business. We never had any glitch, but maybe glitch is from my side. But I don't know. I've never used Zoom. So anyway, that apart. Now let me tell you. I'll start from where Professor Kashnavish left off with a very humble disagreement with him. Number one is I don't believe that the hospital industry in the caregiving services has reached its maturity. Far from it. I think it is in a rapidly growing growth. It is in rapidly growth phase, and the private hospital scenario is bound to grow. I'm leaving it to my friends Alok and Rupak to deliberate further on this. But I feel I feel as a part of the industry, I feel that most of the companies, large companies in their diversification plans are planning for healthcare, moving into healthcare as a greenfield area, as an area of phenomenal growth, because the government healthcare system has completely failed in delivering services to the 1.4 billion people of this country. Then therefore it is left to the private sector, and the private sector is also planning to respond in a very big way. I think so. I don't see that any signs of maturity in the hospital sector, the healthcare sector, specifically the hospitals, the entire range of hospital services given by the hospitals. And for this, as far as these two gentlemen are concerned, friends, I have known them for a very long time, and I know their deep commitment for the students who are here. I think you should learn work commitment from both Mr. Rupak Barua and from Dr. Alok Roy. They are not only work commitment, but concerned for the students. They care for the students, and that is their way they deliver to the society. Management traditionally, when we joined industry, when I joined Tata Steel, we were given to understand that the objective of management is maximization of profits. Now it is maximization stakeholder value, and among the stakeholders is society, and we all are part of the stakeholders as far as Mr. Rupak Barua and Dr. Alok Roy are concerned. I will first request Mr. Rupak Barua, because Rupak he is not only the CEO and director of the AMRI hospitals.
Professor Roy, just excuse me.
Yes.
Dr. Alok Roy is in a little bit of a hurry. He has to leave early. So if you can please call him.
Yes, sure. I would then go to Dr. Alok Roy. Dr. Alok Roy is, as you all know, is the chairman and managing director of the Medica hospitals, the entire group of hospitals. So I will leave it to you. Over to you, Alok. Dr. Alok Roy, please. Yes.
Thank you, Professor Roy.
Yes.
First of all, thanks to SNU for inviting me. I'm extremely grateful here to be with you all the students, Vice Chancellor, Mr. Kasnobis, and all the staff and faculty of SNU and all the students. So the reason why I'm today here, and my apologies to Rupak that I had to butt in, because I have to leave at 6:55, 7 o'clock I've got the medical board for somebody very important which I can't miss. So I have to exit at 6:55, put my thoughts together and be ready for that medical board at 7 o'clock. So friends, what interested me most was that healthcare management in pandemic. So see, I have given a lot of lectures in management all my life. All I've been talking about is how to manage, and especially in healthcare. This pandemic has taught me only one thing, that the management of the world starts from you first. The world is divided into simple two parts, micro and macro. Microcosm is you, is all of us, and macrocosm is the rest of the world. The rest of the universe is macrocosm. When the disturbance happens in macrocosm, that is the world around us, then the micro have to get going. And how should micro get going is what I'm going to share with you in the next 5 to 7 minutes. And I'll just share my very, very personal experience of managing in last 1.5 years almost, and what difficulty we faced. First of all, that we never saw this disease coming. We did not know anything about it. We were not prepared for it. We had no education about it. There is no management yardstick or clinical yardstick to diagnose it, treat it, save it, and keep our population healthy, which is our commitment. So the fear is not because, if you know there's no fear, if you are well prepared, exams are just a cakewalk. But if you have not studied and you're not prepared and you don't know what is going to come from which book, then examination is big fear. So the fear is always of duality of something else. In our case, we didn't know about the disease, so entire world was scared. So were we. The first and foremost, how you prepare yourself as an individual. This pandemic has taught, and I've seen the examples around us from various hospitals, from the world, from everywhere. Those who prepared themselves, those who settled their mind, those who stayed focused, and those who decided to take the world in their stride and went aggressive, they all succeeded. Some people stuck to their ground where they were. I'll explain everything, every word I've spoken so far. Some people stuck to their ground and they never moved. They thought, they shut their eyes that this pandemic will pass, and they did not contribute till the pandemic reached home. and burned their houses. Then they were sucked into it by the circumstances, not by the choice. And third group of people who never prepared, who didn't deal with it when it was on their head, and they died in the process. Let's take the example of the worst. There are many hospitals, when the pandemic came, because doctors were so scared that nobody wanted to deal with the disease. And in this country, thousands and thousands of nursing homes were shut down. Not because facilities were not there, not because doctors were not there. They're so scared to deal with this. They thought very selfishly, though you belong to the front, this world war is biological war. I'm not saying who started, but we will all have to end it. So those soldiers, those who decided not to fire a bullet, they got shot and got killed. Number two level of people who stood their ground, defended their territory, they said, we will not engage it, we will only do non-COVID work. They're still stuck to the non-COVID work. They have not contributed in any way to the pandemic. They have not dealt with the pandemic. They continue doing what they were doing earlier, though in less number. Professor Khasnobis, if you can keep your phone on silent, would be very nice. Because otherwise it's a kind of, thank you, sir. So those middle level who did not engage with the pandemic, they lost out big time on revenue. They lost out on opportunity. They lost out on the name and fame which came with the pandemic for those who fought well. Then there's the first level, which myself and Rupak, both of us belong to. We went aggressive. We went ahead. We dealt with the pandemic on a front foot, engaged with it completely, and we saved multiple lives. So now what management lessons are lying here? That those who did not engage because they were not mentally prepared. So the microcosm is not willing to engage with the macrocosm. Please remember, microcosm, you is a part of society. You cannot stay isolated. Those who were indecisive, they lost their job, they lost their money. And those who were aggressive, those who were stable in their mind, who decided to face the pandemic, they all won. And won in not the sense of making more money. None of us have made more money. But they won in the sense that they provided the relief and to the comfort those who walk through their doors. That is the purpose of our existence today, to provide comfort. Money will follow eventually. It always follows. Name and money will follow eventually. So these three steps which people took in this pandemic. Now, what happened? When the pandemic hit us, because we didn't know what are the medicines, we didn't know what are the suits, what are the clothes, what are PP required, how to change and treat them, we had to metamorphose our hospitals. We realized so many shortcomings in the hospital, which are good for the regular time, but not for the change time in pandemic. So we all had to overnight change our walls. We had to make it negative pressure because we couldn't throw the corona inside. We had to take an outlet system. So converting negative pressure, the entire hospital, we did that because we went and bought the exhaust fan from here, there, we got air conditioning people involved. Once we did everything, we realized that hospital has become very hot because all the cold air is being sucked out. And all this had to be done on feet. Every possible lesson which you have learned in management, that quick thinking on your feet, adding on your facilities, changing parameters overnight, it only happens when you become a team player. When you realize the value of everybody who exists in your system. If you give space to everybody to perform, if you value every person who, so that teamwork, as in every management book starts talking about, stay focused, innovate, quick on our feet for change, and cultivate the team. All these 5 things were so visible in our approach in dealing with pandemic. Remember, we couldn't save lives. It's not that we save. We are the highest production of dead bodies nowadays. In every hospital of ours, we produce 15, 20 bodies. We used to have ambulances outside. Now we have horsemen outside our hospitals lined up. So that's the situation. We are getting, when we admit one positive patient, remember, there are 20 those who are not diagnosed yet and 30 who are asymptomatic. So 30 plus 20 plus 50 plus 30, every positive patient, you have 80 patients you have missed. So if there are 4 lakh positive cases, which are proved positive cases, multiply by 80, those many corona infected patients are roaming around. Do you get an idea? 4 into 80 comes to 1 crore plus. So that is what you are dealing with today. And in that situation, where and civil society was most unhelpful. I'm still so sorry to see that responsibility from youngsters. They're still partying, they're still going without mask. I was on a road last night, I had to go at some place at 11:30 from Park Circus, full of people. No one was wearing masks. You are only making our war difficult for you. But the lesson learned that those who are irresponsible, those who do not follow what society needs will pay a heavier price. So, what is most interesting, that the fundamental lessons of staying focused, dealing with the problem as it comes to you, and aggressively. Sometimes the prevention is not stopping the problem. Prevention also lies in taking a step forward and hitting the ball before it hits the ground. That's also prevention. Sometimes it's important that you understand your team and respect them for what they are. Listen to them and be with them. Today, there is no soldier and no general. Everybody is soldier. Pandemic has taught us one thing, that there is no hierarchies. We are here, any one of us can lose life. The pandemic will not spare because you're a general or you're a soldier. That means everybody has to be equally prepared. That means every soldier must have access to weapon as everybody else has it. So equitable distribution of resources. I've just added one more parameter for you all to understand. Unless all the resources are equitably distributed, you will not. I'll give a small example. When the first pandemic came, we realized there's something known as extracorporeal membrane oxygenation. That's a machine which breathes for you, and the biggest damage in COVID is because the patient is not able to hold on to the oxygen, there's a less level of oxygen in the body. Then every organ, because of lack of oxygen, starting from brain to heart and everything, start dying slowly. That's how patient dies. So there is a machine which works as a heart and lung for a patient. We realized in last pandemic that this machine can save lives. Each machine costs close to 60 lakhs. 50 lakhs is cost of the machine and 10 lakhs for the ventilator and circuits and all that. In last year pandemic, we decided to have 10 ECMOs. And it was a large number in the country. 10 ECMOs were running last pandemic. Before this pandemic hit us, we got another 15. And suddenly we realized we're the largest ECMO provider in Asia. Now, there's no dearth of people in this country. But why nobody thought of it? Because none of them want to go aggressive, and costed me every penny I saved in the last 1.5 years. The entire process of buying costed me more than 15 crore. 15 crore is a lot of money for any healthcare today in this pandemic. So the right amount of investment in resources is paramount in saving lives. There's no return on investment made here. What I'm trying to point out for the students, that it is important for you to make profit, but it's also important for you to deploy resources when there's no profit also, because here the profit has shifted from currency to the human lives. So the shifting of profit from currency to the human lives is a new parameter, is a new dimension. So every time, if we go by what my point I'm going to put up to you, that the same surface on which we are operating, or which is known as profit, suddenly got changed to human lives. And that is something which is invaluable. No profit can ever compensate for that. You don't know whose life you are going to put. Today, we have put people who are 29-year-old, 30-year-old, 35-year-old, 40-year-old, 50-year-old, 60-year-old on ECMO. Sometimes we have put somebody as a 19-year-old on ECMO. So you need to define your bottom lines based on what exigencies you are in at that point of time. So I would conclude my saying here by 5 things which I want to add on. Stay focused, stay quiet. You need to adjust your mind. You have to stabilize your mind. Your mind, your biggest friend and worst enemy. Second, innovate. Third, don't hesitate. Hesitation in pandemic will kill you. And your internal nature will decide you're going to fight or you're going to flight. So stabilize mind, use the occasion to go in and engage aggressively, build team, be ready to change at a short notice. Whatever happens, if the change has to happen, accept it and move on. And the bottom line is not always standard bottom line. I will conclude by saying that till few years back, we used to treat patient based on his disease. When somebody has got a heart problem, we'll treat him. Somebody has a lung problem, we'll treat him. Today, we treat patients by the expectation of the family. One 29-year-old boy brings his father, who's 65-year-old, and says, do whatever is required. I want my father alive. We all jump on him. We put him on ECMO, this, that, ventilation, save his life, and send him home. Same, one more 29-year-old brings 65-year-old father and says, it's okay, don't disturb him, let him go. We all withdraw our hands and allow him to pass away. So a lot of responsibility have shifted from physician to us, to civil society, to take decisions about our near and dear. Of course, some part of it is decided by our fiscal responsibility and capability also. But mostly it is our mindset. So one thing, if you want to work on in your life, is settle your mind, and you be at peace with yourself and be stable. Then no pandemic can ever shake you and you will emerge winner. Thank you very much.
Thank you very much. Thank you very much, Dr. Roy. Doctor, can I put one small question to you? Do you have time for that?
I have time till 6:55, sir.
Okay, fine. I think the striking thing that you told us today was about, especially which is of great significance to the students, is team. They have to learn to be in teams. How effective? I mean, you have been a team builder. I know you, and also the need to stay calm. Doctor, let me ask you: do you still have that putting hole in your office?
Yes, of course.
Anyway, that team. I mean, your team. I have seen during peace times, non-pandemic times, but now it's a war-like situation. I'm sure. How are these? Is there fatigue in your team, and how are you leading it? You always lead it from the front, and so how important is the role of each member of that team, of your team, and what is the strength of your team now here? Yeah, I'm talking of Kolkata, not the other hospitals that you have.
I have a half an hour session with my team every day. We have 6 currently hospitals which are running in different locations, and the team, all of us get together in the morning, and I give them a talk not on management. Every day, half an hour, I pick up small pieces from Gita or Upanishads. I tell them how to stay calm. So everybody in our group practices how to stay calm. I said, you are capable people. The problem is that we all are very capable. Because we are not able to manage our anxiety, we make mistakes. Just manage your anxiety. I tell everybody, manage your anxiety. You can't change everything. Like we have a very difficult decision today to save a 57-year-old man or 29-year-old girl. We chose 29-year-old girl. Now, nobody can ask me. By no court will punish me. My punishment is in my heart and my mind. Why did I choose 29-year-old girl? That question is that, so such decisions only come when you're very calm. You decide about things, such decisions you take. So my effort with our team is to stay calm. Don't get agitated. Whatever may happen, don't get agitated. As a result, they all deliver and they're not tired. We have been working day in and day out and they're just not tired. And we take every call, not a single call we miss. And believe me, I get personally close to 2,000 calls a day, and I'm not joking. I respond to 500 plus WhatsApp a day, and I'm not joking. So you can imagine how many people we are dealing with. But that's the way it is. Stay calm. You can win anything.
Thank you. So it's calm. Resilience.
Thank you.
That's what.
Thank you, sir. Thank you, sir.
Yes.
May I ask a question?
Yes, please.
Hello. What about the business during the pandemic? Has it expanded or declining?
Sir, business is expanded. Profit is declining.
It is expanding.
Business is expanded. I've got now.
But
if
profit
you
has declined.
If you got number of beds, I've got now we had 414 beds. Now I've got close to 900 beds in Calcutta itself. That's not a question, but my profit has declined, taken nosedive.
And can you concentrate on your key products now? Can you concentrate on your key products now?
All key products are shut.
All key products are shut.
Yeah.
That is the scenario I was actually explaining. The key
I
products are shut. And you are
key products are only valuable when you are in a peacetime.
That's it. That's true.
Yeah.
Can you get back, sir? Can you get back your key products in post-pandemic scenario? What do you hope?
They will just walk in. We have experience. Because sir, if you need a eye surgery, you're not going to the hospital because we are in pandemic. The moment pandemic comes, first thing you'll do is get an eye surgery done. So nobody runs away from the hospital. You can't run away because you are inconvenienced. So our key products are not going anywhere.
I understand. Would you get more competition in the post-pandemic scenario on your key products?
Sir, healthcare is a deficient market. We are not competitors. We are collaborators.
Collaborating.
We collaborate because we are in deficient market. We are in short supply. Demand is far more.
Can I?
Hello?
Sir.
Hello. Dr. Roy, can you take a question from a student? If any student wants to ask a question, because Dr. Roy will be going away. So the Q&A session will not be there. He will not be there during the Q&A session. Any student wants to ask any question to Dr. Roy?
1 minute. I think Vice Chancellor wants to ask a question. Sir, you are on mute. Sir, you are on mute.
One question is in the chat box already. If you just have a look at it. Professor A.
I can't see. My audio is video is not there. Video.
Yes.
Okay. I will read it out. I will read it out. This is from Ornit Das.
Which point should healthcare sector note and need to develop for further pandemics? How healthcare sector should manage the further waves of COVID-19? We have to, first of all, we have to work on public health. public health is a huge issue and which needs to be addressed at this point of time. And second thing, more investment from center. See, the healthcare is something which needs a huge investment. And traditionally, in last 70 years, we had a very poor investment. Government has not strengthened its facilities, and government has not really invested as much they should have done in primary health and tier 2 and tier 3 cities. So health, 80% of good healthcare is restricted to 20% of the metro and big cities. So that unequal distribution has to be corrected. So two things which are important, and I will conclude here by saying this. First, public health. Second, we need to get into the smaller market. These two things are there.
Yes.
Thank you very much. Nice talking to you all. Thank you. Rupak, you must
you.
forgive me for leaving now.
Thank you, Alok. Thank you. Thank you.
Thank you, boss.
Thank you. Thank you very much.
you,
Thank
Dr.
you
Roy.
very much,
Thank you,
Dr. Roy.
Thank you, Dr. Roy.
Thank you. Thank you.
Thank you.
Well, now I think it's my very pleasant duty to request Mr. Rupak Barua, a very, very dear friend of mine, he's wearing two hats actually. He is the president of the Private Hospitals Association, plus he is the director and CEO of the AMRI hospitals. There are, as you know, there are 3 hospitals right now here in Kolkata plus Bhubaneswar. And I have known Rupak for a very long time, and he's a manager who, not being a medical person, as a man who has turned CMRI and Birla Heart Center, and he's so approachable that he is another person like Dr. Roy whose phone, he always responds to a call, he always responds to a WhatsApp, and he always tries to help. So Rupak, can you just share with us the challenges? Dr. Roy has spoken of the challenges at this particular time, but you, purely from a management point of view, as a manager, as a leader of teams, you are suddenly faced with this terrible situation of a second wave, and how this crisis, how are you managing this crisis?
Thank you, Professor Roy. Good evening, everyone. And it gives me great pleasure and honor to be here and sharing my views with this esteemed audience. Yes, healthcare sector is going through a turmoil that we all can see. As a nation, it is going through, and the whole burden, because this is the pandemic started. Started last year. What we started facing, as Dr. Roy was also mentioning, and what we taught out of this, this pandemic, what we learned out of this pandemic, and in the beginning, I think the Vice Chancellor also was talking about the growth and the opportunity of this healthcare. Just before this pandemic, I would just like to share with you this little bit of the healthcare sector. Yes, healthcare sector is a very growing sector, and it has not yet reached to the peak level. Still, it is going on, is in almost 17.6% of the CAGR this healthcare sector is going. In spite of this huge growth, we could witness last 15-20 years of money almost. That's the same pace it is growing, and it is the growth rate is very high. Still, so far the opportunity is concerned in terms of the bed strength, and there is a huge crisis still today, in spite of growth of 17.69%. You see, as of today, if you consider the bed infrastructure wise, we are having 1:1,000 bed, which as per the World Health Organization, it should be 3 beds per 1,000 as per the, and we are quite behind of the scenario of your other developed countries. Now, in terms of, yes, of course, one part is that there's a infrastructural opportunity we have, and there is a opportunity in terms of business opportunity because there are many areas opened actually for this healthcare sector. Now, India is expected to rank amongst this is the top 3 healthcare markets in terms of incremental growth by 2020. I'm talking about the Indian healthcare. And if you see that financial year 2019, Indian healthcare sector stood as the 4th largest employer, as it employed total of 3.5 lakhs, 4 lakhs employment opportunity we could see in the 2019. So it is the 4th largest employer. So there is a huge opportunity that we can see. Now, there are many reasons for growing of this healthcare. There are many reasons because of the healthcare sector per se. It is changed a lot now. There's a demand growth is different. People, the rising income is one part, and there is a opportunity in this your international tourism healthcare sector. That is one area. Then your research and education, this is one area. There is many ways this is growing, and the major growing actually in terms of your digital and the technology. Both this is the digital part, so for the healthcare sector is concerned, and the device part. That is also a big area that is the healthcare sector is growing. Now, in spite of everything, when this pandemic started, we could see that our healthcare sector is very, very immature. Why it has happened? See, if we consider the healthcare sector in terms of the bed strength and the population, there is a 70% of the bed actually is being dominated by the private sector. Dr. Roy also was mentioning because of the public health actually, the healthcare should be supported by the major part is the governments, that they should support the healthcare. What happened that there's major infrastructural issue that we could see, particularly in the tier 1, tier 2 places, and also in the primary healthcare segment, secondary healthcare segment. 20% of the healthcare actually in the city bound area, and 80% is in the rural area, which is absolutely neglected. There is a huge deficiency of the doctors, nurses, infrastructure. There is not many of private healthcare providers presence in this your tier 1, tier 2 places. Doctors doesn't want to go there. So there is a huge shortfall in terms of your infrastructure, in terms of your human resources as well. So that place actually have not yet grown, and all the burden of this your healthcare, the tier 1, tier 2 places to some extent, particularly in the tertiary care. Secondary care, okay, sometimes they are taking care, but the major part is the tertiary care, the super specialty care. The whole burden is coming to this the city level, and that's why you will find there is a lot of district patients, the rural patients actually filled up in the private hospitals of Kolkata, the city private hospitals. Now, when this pandemic started, that is we used to manage healthcare in a different way. More we are looking for quality care, more we are looking for better patient care, we are looking for NABH, we are looking for JCI. Lot of that we are giving a lot of stress to this major way in the quality care. Now, when this pandemic started, actually, we never faced this kind of a scenario. It is an invisible enemy. We are not having any idea. There is not, and as I mentioned earlier also, we could understand that's how this healthcare sector is so premature, immature kind of a segment. So then we are not having much of idea about this pandemic, the invisible enemy, and we started understanding how it behaves. We are starting getting because it's a very new in the worldwide. If you see, it started maybe December, Jan, and it hit in actually in the month of March, April in India. So that was a huge crisis that we could see. There is an infrastructural crisis, there is a human resource crisis, and there is a supply chain crisis. These three areas that we could see apart from the financial crisis. If you see the first quarter, the last year I'm talking about Q1, the April, May, June, this suddenly the total, your healthcare, if you see as a combined, your total turnover of healthcare, it just dropped to 30%. And there's a huge, the challenges of the extra additional expenditure because of the your safety gears, because of the huge human resources requirement. That was a very, very challenging time. This during the first quarter, slowly we started understanding what is happening, how we should handle this one, and doctors were also started becoming a little bit comfortable, and they have started understanding the behavior of this virus, and we could handle the situation in much efficient way. In spite of a lot of staffs got affected and infected, and they were out of the circulation, so there is an additional manpower we had to hire. But you know that again, particularly in Bengal, there is a huge crisis of the doctors and the nurses compared to other states, because our production of the nurses is hardly 15 to 17% of the total requirement in terms of private care. Whatever their production is, more they are absorbing in the private, government sector. So we are dependent on the more in cases of outside nurses. And that is almost 75 to 80% nurses we are dependent for this your outside, like your Kerala, this is Karnataka, this is Jharkhand, Northeast and all. So that was a huge crisis, because and the doctors RMO, yes, of course, there is a huge gap so far. Now, as of now, doctors there is a doctors shortage is almost 1.6 lakhs of doctor shortage in India. There is a 6 lakh shortage of the nurses already we have. So these are the crises, these are the challenges which we had faced. There is not proper medicine was available at that time. There is a supply chain was crashed like anything, because that's a pandemic. There is no transport was available. So we had to arrange, because there is if you see, there is a in Kolkata, sitting in Kolkata, there is hardly any production manufacturer here in Kolkata, because nobody was having much of idea about this COPP, N95 particularly. So then we had started talking to the government, then MSME, then they started manufacturing this kind of a PPE and N95 and all, and we could manage the situation during that time. Also, there is a one part that we could get some time. You see that the difference between the last year and this year, second surge. First surge, actually, it took some time. It started from end of March, and the peak level reached to almost in the month of September. So we could get time, and slowly we augmented the beds. But now if you see the second surge, there is a different kind of challenges. The different challenges is that in a short time, in a month time, actually, we reached to almost to the peak. Though there is a little bit variation of the comments, there is somebody is saying that we have not yet reached peak. Maybe it will take another 7-10 days time to reach peak. But in 1.5 months time, actually, the whole thing happened, and there is a not sufficient number of beds. Why there is no sufficient beds? Because the last year, there's a sudden drop of all the non-COVID patients, general patients, because of the lockdown and all those happened, and we are not having much of idea about the pandemic. But this time, we started knowing the pandemic from December onwards, January. There's a non-COVID patients started moving. Many people, many senior citizens actually, those who were waiting for treatment from the doctors or the surgery to be done. So they started moving out of their house, and they started approaching the hospitals for doing surgery, the corrective surgeries and all. But suddenly this pandemic, I mean the second surge, there is a non-COVID patients are there for surgery and all, and there is a huge demand of the COVID. So overnight, changing from non-COVID to COVID, it took some time, but still we did a lot. The whole private healthcare actually converted almost, I'm talking about in Kolkata, almost there is a 5,500 beds we have created as a whole, and we are serving people. This time, what we could see, there is a huge demand of the critical care beds, because most of the patients, those who are between this year 35 to 45, below 50, they are more requiring is in critical care. So getting the because ventilators, critical care requires a lot of ventilators, monitors, BiPAP and all. Getting this from other states was a big crisis. So somehow we could get it. And then Dr. Roy was mentioning about ECMO. There is a huge demand because this is the ultimate treatment of COVID patients. That also we could get. So this way we had handled the pandemic. So I talked about this year, as a whole, the healthcare infrastructure, where we stand right now. The one part we discussed about the first pandemic, how we could manage, how we could overcome those challenges. And this pandemic, which is this second surge actually, which is going on, that is also one big challenge that we are facing in terms of augmenting beds from non-COVID to COVID, and managing the critical care, because that is a major crisis in the critical care area. These are the challenges. The challenges of shortage of the human resources is still there. Still we are managing, somehow we are managing those human resources, and we are trying to extend all kind of a best possible support to the patients. Now the question is this other financial part. More on a lot of questions were coming up, how you are managing the financial part. Yes, financial part, yes, there is a demand. There is almost the hospitals are running full. And full means, yes, of course, in the COVID segment, non-COVID segment is still, there is a not more than 45-50% of the occupancy we are managing. But COVID patients actually doesn't give much of financial support, because that is a definite kind, that is an emergency crisis, the disaster. We have that is emergency and disaster kind of a situation. So we'll have to take care of the patient. So our charges and all we kept as low as possible, other than some ECMO patients and all, that cost really is very high. But otherwise, general patients and all, we try to keep it in a very reasonable way. And there is a financial crisis, but yes, of course, we are absorbing that financial deficit, and will be able to overcome the situation in a very short term. So, Professor Roy, that is this much. I now more. I think I would like to. If we can ask questions, then I think we'll be more specifically. We'll be able to address the situation.
Dr. Barua.
Yes, please.
Can you concentrate on your key products now?
What does it mean? What you exactly want to know? I mean, the products means your
certain key areas in which there are certain key areas in which your hospital has specialized, and you made a lot of investment in that area. This I call as the key area.
Okay.
And I think the occupancy rate there is low now.
Yes.
And that actually, that gives a scenario where you should face a financial crisis, because in that area, the occupancy is low, and the revenue that is generated in that area will be rather low, as a result of which the total revenue generated in the system could become lower.
Yes.
Is that true? Or
yes, that's right. You are very true that we had invested a lot in terms of.
Yes, you had to.
Yeah, in terms of building the infrastructure. So we had built up one, if we are talking about AMRI, we have extended one of our units in Mukundapur, that we have extended additional, that's a state-of-the-art hospital. We had invested a lot in terms of super specialty.
Rupak, I finally got my voice, and I finally got my video. Can I interrupt? Sorry, yes. Professor Khashnovish, I interrupted something that I wanted to ask for quite some time. The most striking feature that I find in your leadership, Rupak, this is basically about a leadership style, that you never let grass grow under your feet.
Yes.
I saw in the papers today that you have taken over one part of the Lalit Great Eastern Hotel, and you are converting it to a COVID facility.
Right.
And this is for the affluent section. Now, this is something which I think the proactive, or rather the preactive nature of your style has always kind of not baffled me, but I've earned a lot of respect from my side. I've always seen this, that before it hits you, you don't react, you preact. So this way, I think you tell me what thought went behind taking over this 5-star luxury hotel in central Calcutta. Is it because you didn't have a facility out there? Is it because of that
yes,
that you wanted to? Yes, Rupak, please.
So, Professor, is a very interesting question, and a very right question in this audience. Addressing this audience. See, every time if you are talking about me, or I will say all my budding managers are there, they will take over the hospitals or whatever. But the industry leaders, everyone should come out. One thing we should learn: every scenario, every situation, you will have to see the opportunity. Every scenario, yes, it's a pandemic, but there is an opportunity. So never lose that opportunity. That is the whole part. So what we have studied, and you will have to be very fast in making decision. You cannot just wait and watch and see, because these are the pandemic situation, and you will have to take call very fast. So what we, as you are mentioning about these hotels and all, so what we could see, that is a number is 18,000, 20,000 is growing in Kolkata. And we do not have sufficient number of beds because we have limited number of beds. That is the one. Second is, all the patients, they don't need to reach out to the hospital. They can stay at home isolation and all, and mild, because majority of the cases which we see 20,000, 25,000, or this India reached to 4 lakhs of cases, you'll find very negligible percentage of the patient needs hospitalization. Major part, so far the COVID behavior is concerned, major portion of the patients can be treated in a home environment. So when we could understand this, so we could see that the majority of it has also been seen that many of the patients, those who are getting infected, they can't stay at home because there is not sufficient rooms up there for isolation, and there are aged parents and all. So that is clicked to our mind, and we said then these are the patients should be ideal for home isolation. And if you are not having this your home care facility, so better to send them to a hotel facility. So this gap, actually we could understand that we did this gap analysis, and immediately we wanted to do something. How we can act first to give opportunity to the patients to get admitted in one place other than the hospital, and also the financial part as well, because we'll have to manage the financial, because that is an additional financial gain that we can get. So immediately we started opening the hotels, and we started bringing the corporates. The large number of corporates actually is in our panel right now. They have booked their rooms, Tata Steel, ONGC, Reliance, all the big companies, ITC, ICICI, IBM, they have taken all for their employees, taken a couple of, few rooms, 10 rooms, 20 rooms, 15 rooms. They are fixing up the rooms so that if required, they can put their employees as a hotel isolation. So we have taken the large hotels. Even we had approached to the government that there is a, that Salt Lake Stadium also we had converted to a hospital, semi-hospital. We call it field hospital. So considering the crisis and to overcome these crises, so what we did, the first phase that we are talking about the hospital. That's the first is the critical care. Then this is a general bed category. That is a fixed number. You have limitations. You can't increase number. So what we did, then we started a 250 bed, that is your Salt Lake Stadium, that we converted to a field hospital. That is for mild to mild to moderate kind of symptomatic patients, and the hotel, that is a asymptomatic patients to mild symptomatic. So we have graded. So first is the satellite center, the hotels. Then the second one is can be there in the your stadium, that is the field hospital, where there is an oxygen support and all doctors, nurses, all stations that we had made. That's a big one. The youth hostel, that your Jubo Bharati Kridangan, we converted to a hospital, and that's a big 250 bed. There is a lot of nurses, and it's an absolutely vibrant kind of a hospital that we have created, and it's a very good occupancy is going on. And this is the third phase. From there, from the field hospital, any patient is getting crash or needs additional support of the health, your ICU or HDU, we are shifting the patient to the hospital. So these are the things you will have to, as a manager, as a leader, you will have to foresee tomorrow, day after tomorrow, what is going to happen. Now, one area opportunity, that is a digital one. That is an innovation, because today is the innovation can give you much wider mileage compared to anything. You will have to be very disruptive. So what we did, started doing, there is a home isolation patient, but they don't have any reach out to the doctors. They are quite helpless. We started home isolation care, virtual home isolation. Almost 200, 250 home isolation patients we are taking care right now. This is all cost. Your revenue is coming to this one, and equally we are helping out the patient as well. Then there is a telemedicine. Telemedicine, which we have expanded a huge. We started telemedicine. We tie up with a IT company and Hyderabad-based IT company, and we started this telemedicine. Almost daily, we are doing 100, 150 telemedicine, including your Bangladesh, Nepal, Bhutan, and we have reached out to everybody. And that is a huge revenue is coming, because that's all consultation and all. And that is also one type of, I'm just giving a managerial kind of one. This is one is your, you are giving service to the patient, and you maybe to some extent you are generating your revenue. But tomorrow, when this year will overcome the situation, this year, this pandemic, then next will be able to, this is a networking. So we are networking because it is a future business.
Yes.
Otherwise, one day it is going to, this your pandemic will overcome.
Right.
What will happen to the next one? This actually branding.
You have such strong networking skills, Rupak. That is known. That is a really known network. This thing. But one more thing, that is, as the CEO of such a huge establishment, now how do you balance your time? In the sense that, so many things must be coming now. Pandemic is this, but non-pandemic also a situation is there. There's certain other things. You have got your HR. Incidentally, your GM HR was also down with COVID. I am perhaps the only participant here who is COVID positive, and I take my strength and clue from people like you and Dr. Roy. And so now, how do you balance out your time? Then another thing that you have done remarkably in AMRI, after that huge fire, huge disaster, you have built it up, and you are back on, not only back on track, you are ruling the roost as one of the largest hospital chains in this part of the country.
So, Professor, is also a very interesting question. This is how I balance my time. Yes, of course, we are having now, I am having 4 hospitals now, 3 in Kolkata, 1 large setup in Bhubaneswar, and managing around 1,200 beds. And at present, managing 800 out of the 1,200 beds, 800 is a COVID beds we are managing. That's that's the human resource crisis. Finance is almost there. There is a lot of challenges that we're facing. So majorly, I distribute my time. I share my time. This is the first what I did actually. We have created a strong corporate team, and we have strengthened this your individual unit. So I have decentralized more of the work. Actually, is a central decentralized the work in this unit level. All the unit are taken care. But major part what I see, I spend almost 30% time to my HR development, because human resource is the major area of concern in healthcare. you will have to give a lot of time. So like all of your institute, we go for tie-up, we go for manpower, how we'll get the manpower. I mean, you will have to think not today, you will have to, as a leader, you will have to see tomorrow, day after tomorrow. So accordingly, I spend 30% of my time for HR. I spend almost 30% time for my project as well, development. These are all my, I am bringing this your new projects, new satellite center, new healthcare center, tying up with the government or discussing about how we can manage it. So this is a 30 to 35% of my time I'm spending to develop this one. So I'm thinking different way, how further I can do, what I can do further. So all time you will have to think of 20%, yes, miscellaneous, that is your daily operational stuff.
Great.
So this
Wonderful.
way I distribute my time.
Rupak, there are a couple of questions from my students. This is Vinita
Let
Chatterjee.
Oindrila read out. You don't take the pain. Let
Okay. Oindrila is here. Okay.
Yes,
let Oindrila read. Yes,
we have
please.
two COVID positive members here. One is Professor Shantanu Rai and the anchor of today, Oindrila Mukherjee. Both of them, in spite of their illness, they are here to conduct the show.
Great. Oindrila, please.
Oindrila? Where's she? Okay, Shantanu, you continue reading the questions. In the meantime, she might join.
Okay. This is Vinita Chatterjee. She says, just a minute. Lost. The gist of her question is that citizens about getting to create an awareness among citizens to get vaccinated, and experts expect the third wave. Now what should be done to make up for the mistakes done in the past and counteract the same? That means what she wants to say is, I would also like to add that we watch countless image countries across the world, etc., trying to know what she wants to. The gist of what her question I could make out is that what shall we do? How are we preparing for a third wave, which possible third wave which might hit us? Rupak, this is from Vinita Chatterjee, our BBA student of hospital management.
So your major question is the vaccination drive, actually.
Yes.
What is happening? See, since this your first pandemic started, we are all talking about the vaccine because that is the only hope. That there is a lot of research was going on, and we are expecting when this vaccine will be able to start this vaccination program. Now, from January 16th, we started the vaccination program. That's a two vaccine is available in India. You all know the Covaxin and the Covishield, and there is a third one is going to introduce in a couple of days time. Already 2 days started actually in Kolkata. This is a couple of days time it will take. That's a Sputnik V by Reddy's Laboratories. So that is the whole vaccine part. But what happened actually? The first phase started. January 16. That is related to exclusively for healthcare workers. Second phase actually for the frontliners, police, Kolkata Corporation people, and all those things. Then started is your 45 to 60 comorbid, with comorbid, then no comorbid. And now the third phase we are talking about 18 to 44 years. So 18 onwards actually all will go for vaccination drive. Now, this vaccination program actually what happened, there is I don't want to go into any kind of controversy or whatever happened and all there, but there is a huge shortage at present now because the production is not there. The way there is a demand, 130 crore population or 135 crore population to drive, And if we are not giving 50% of the population is not being vaccinated, then you will not reach to a herd immunity. So as you are more concerned about the third surge, so that is the only way that we can we can protect ourselves. That is the vaccine. Vaccine is the major way. Now you must be aware about, because there is a lot of discussion happening in the media. There is a how this your they are expediting this your vaccination their vaccination production. See, vaccine is a biological product. There are a lot of protocols and all one has to follow. There is a quality control, inside quality control. Then it will go to the CDCI for more of the external control. So we are expecting that as per the government notification, maybe from July onwards, we'll get start a lot of vaccine. Government has also allowed us the import of the vaccine of the Pfizer and Moderna, but that is also not, they have not given approval as yet. So third surge to protect is of course the vaccine, which we are expecting from July onwards. Many people will start getting vaccine. Now we are passing through a very hard time so far the vaccine is concerned, but definitely we'll get a better kind of a response from second week of June. But the major part that we can only protect ourselves, that still we'll have to continue with this your mask and sanitizing our hand washing and your mixing of people, that is social distancing. All those things we'll have to follow. So that is the one part, is the vaccine part. Yes, of course, now 18 plus is very important segment, the students category and the working class. They are going out each and every day. Now, definitely, how long the students will be online classes and all will continue. So they will have to start their classes, offline classes. So vaccine is very important. The government is taking care. We are expecting from July onwards, yes, of course, the situation will be a little better. Third wave, all we are talking about maybe September, October, because the scientists, they are predicting, but still we are not very sure when this third surge will be coming. But before that, we should go for vaccination as early as possible, as much as possible.
I think Ondila is here. Ondila? Hi, Ondila. Yes, Ondila will read out the next question. Hi, Ondila. Hello.
Yes. Hi. Good evening.
Welcome to the show, Ondila. Yes. Please read out the next question.
I will carry on from here. Well, the next question is in fact a very relevant one from Upasana Kundu. What strategies would work irrespective of socioeconomic differences to empower people to be responsible for their health? And is there a scale that can be used in emergency departments to detect level of severity in elderly people?
See, there is no, no scale actually is there to understand the severity. That is not there at present. Yes, there is a lot of innovation is going on, lot of research is going on in terms of your COVID situation. There is a lot of companies actually directly now working on different segments. And we are expecting that, yes, of course, many of the innovation will take place. There are a huge number of startups actually started working on this COVID in many ways. And shortly, maybe we'll be able to get a lot of new ideas, in terms of your understanding COVID, testing of COVID, and your severity to assess. Those are the things is on the pipeline. That is we are going to get it. And to differentiate this is a socio-economic, yes, of course, that as I discussed earlier also. See, this is our primary healthcare, secondary healthcare will have to strengthen more, and so that these are the people actually, the downtrodden people, the poor people can get advantage of the healthcare, because there is a huge gap in terms of your getting better healthcare access. Accessibility and the affordability is a big issue, and we'll have to strengthen the insurance companies as well. As of now, yes, of course, there is a 13.8% of the CHER growth is there in the insurance premium, but more insurance will have to introduce. There are a couple of government initiatives. There is a Swasthya Sathi, a lot of government projects are there. And that is also, one is a Pradhan Mantri Yojana, that is, you call it the Ayushman Bharat. These are all for this downtrodden socioeconomic kind of people. These are there. Government is also trying as much as possible. We'll have to create more of the hospitals in the secondary category, so that all investment should not take place in the tertiary category. Primary and the secondary will have to strengthen. Then only will be make this healthcare affordable, and more people will be able to get access to the modern healthcare.
Upasana, let me add, Rupak Barua is one of the fittest persons who is a friend of mine. Fit as a fiddle, actually. And with due humility, may I state that at 70 plus, I still do my workouts at home, and you can see an evidence of this here. Here is my punching bag as a part of my workout, and I've crossed 70. And I'm apart from my university, as you know, I am sitting in the board of 7 listed companies, and I drive my own car also. Now, fitness is, I think, in the mind, basically in the mind. Though I'm a COPD patient, I think it's in the mind, Upasana. You have to think fit. Otherwise, at 71 plus, I would never have thought I'm fit. Most of my friends are retired and are golfing or are sitting and drinking beer at the Tollyganj Club. But here, I'm talking of my Tata Steel friends. But I'm still doing, God is allowing me, but I must have my morning workout. And this is the room where I have my workout. I have a small treadmill here. I have a punching bag, and I have my workout. It's a small gym I've got in this room. So that's how I keep fit. And Rupak, of course, is the last word of fitness. And so is our chancellor. In fact, Shottam, your good friend Rupak, he has to go to the gym every day. He has to go to the gym every day. Yes, Oindrila, I wanted to add this.
I would ask a question.
I add to this your Professor Roy's part. That is that you will have to feed both mentally and physically.
Yes.
What talking about physical fitness is very important, but mental fitness is also very important to stay it as a whole. I mean,
definitely,
Yes.
and we should
Definitely.
learn something. We should learn from Professor
I want
Ray.
to ask a
undoubtedly.
question.
Yes.
Can I ask?
Yes, absolutely. Yes,
Can I?
Definitely. Yes.
What about the health insurance sector, Mr. Barua? During the pandemic, the liability of the health insurance sector has increased like anything.
Mm-hmm. Yes, tell me. Yeah.
During the pandemic, the liability of the health insurance companies has increased like anything. Is it true?
Yes, of course.
And how they are coping with, and are you facing any problem in that area?
See, health insurance is a big area. If you are talking about how this this healthcare, if you see, we are discussing about healthcare, Indian healthcare, how it has reached to a very lucrative segment. It has become one of the fastest growing organization on this industry.
Good business, yes.
Good business mean is the fastest growing industry, we can say. It has only happened when in 2000 there is due to this deregularizations of the insurance sector. Earlier we used to have only this Mediclaim and all. There is a GIPSA, there is all Mediclaim policy of the Oriental Insurance, National Insurance and all. After 2000, there is your parliament, they had passed through this, deregularize the insurance sector, and they have formed the IRDA, Insurance Regulatory Development Authority, and they have allowed the private healthcare to get into this insurance, and it has started growing actually. From now, it is this insurance sector is almost a 13.17% CHER. See, the last year in the year 2019. The recovery of the premium actually, it has reached to 7.39 billion, when it's 51.637 crore actually the premium collection. And that is the big segment is the insurance. I mentioned earlier also that health insurance is very important part and parcel of each and every one. Now, during this COVID situation, what happened? Insurance sector, they had started this your COVID coverage and all, and they have given a lot of support to the common people. They have been to so that they can get benefit out of this financial support out of this your insurance. So that happened, but this year they are little bit restricted way they are moving now. They are not allowing each and every policy holder to go for home isolation or this your satellite center and all. So they have started restricting the expenditure pattern. So this they are trying to make in other states. They have done this is a restricting this your COVID price, COVID package they had introduced. So many things they are doing. But yes, of course, this insurance sector is the last year during this pandemic, they had given a lot of support to the common people. But again, that is a maturity is quite high in terms of premium collection and the expenditure to the insurance that was very high. But that is insurance issue, insurance problem. But it's a big support given to the common people, insurance sector. And it is
during the first phase, yeah.
Going.
And in the second phase also.
Thank you.
Second phase also, insurance sector.
Yes.
A lot of support. That's no
lot of support. Yeah.
Yes.
I understand.
Thank you.
Thank you,
Mandira.
Professor Kashnobis. Yes, I'll carry on. Ognimitra Chaudhary. Another question, Ognimitra Chaudhary. How can we control the black marketing of beds, oxygen cylinders, remdesivir, and various other healthcare products? Very, definitely a concern, as we've heard several of the cases where it is quite severe with black marketing. So how?
So it's very unfortunate kind of a situation. This time particularly we could see in the first phase, first surge, actually we had not faced this kind of a situation. What we see pan-India basis, it's not the problem of Kolkata, this is happening everywhere. There are some reasons also. You find that is because that's a demand supply gap. There is a major demand actually happened in the medicine that you are talking about, remdesivir, and there is a demand of the oxygen. Every day we are talking about there is a shortage of oxygen. There is a lot of patients died in Delhi, that there is no oxygen. And the black market. Black marketing it usually starts when there is a huge demand and supply gap. And some of the
webinar
actually they try to take the advantage of the situation. That is the government part. The government will have to take action. Government will have to the strict vigilance has to be there to stop this kind of activity which is taking place. Remdesivir, why it happened? Because remdesivir is a drug which is the very short expiry. Earlier it was three months, and now it is giving 6 months. Once this COVID started declining the number in the month of December and all, January, there is a huge stock of remdesivir. So all the companies like Cadila, Cipla, they thought of that. There is a down of this year COVID cases, so we should stop remdesivir production, because there is no fun of producing remdesivir without when there is a no case, because remdesivir is being used particularly for the COVID cases. Now, once this that I mentioned earlier also, this second surge actually happened overnight. In the end of March, April, May, suddenly it started when it reached to almost to the peak level. Remdesivir is a huge demand started, and there is no production because company had stopped producing this remdesivir. Now the government has given order to start production of this remdesivir. There's all production started, and we are expecting already. It is little bit, the supply has started coming in the market, and we have also started getting. I think in 7-10 days time, you will find that the remdesivir is plenty available, and there is no black marketing. And that opportunity for the businessman will go, and this will be happening. So far, oxygen is concerned, is of course this second surge actually consuming huge amount of oxygen. Oxygen, I mean, more of the patients also getting affected. More of the patients actually in the home isolation, they are procuring lot of cylinder oxygen. Oxygen is two part. One is the LMO, liquid medical oxygen, and one is the cylinder oxygen. Particularly the large hospitals, we are all we have a plant actually for LMO, liquid medical oxygen, but there is a no shortage. LMO, there is no shortage, but the shortage is particularly in the cylinder. There is a huge demand, again, demand and supply. Some businessmen, they have started taking the opportunity, advantage of the situation. They are selling it in a very high price. So I think this is, government will have to take action immediately. More vigilance has to be there, the police control, everything, and the stern action has to be taken by the government, so that nobody should take this COVID situation as granted and for the business purpose. That one has to do.
Thank you, there are actually lots of questions pouring in. Do we have time, Professor Ray, to take in questions? But I think
we have two more. Rupak, there's one question by Mayushri. Mayushri, our BBA student. There is one question by Mayushri. After this Ognimitra, I think there is Mayushri. Ornit has already put a question.
Yes.
So Ornit's question.
I'll just ask Mayushri's question.
Huh?
Mayushri Tripathi. I'll ask Mayushri's question. If someone is infected with COVID and has, was infected and now no more, as in got cured, how many months should he or she be not, have that period where, you can get again? What is the gap period where you can, you wouldn't be getting the virus again, infected again? Hello, Mr. Barua?
See, there are a lot of mixed ideas actually. Pouring in different medical journal. Submitting different kind of an opinion. But usually people talk about that once you are infected, almost 6 to 8 months actually you are protected. Your antibody there in your body to protect you for maybe for 6 to 8 months. But again, there are exceptions are there. There are many patients getting infected within this your 6 to 8 months also. So how you can protect yourself, whether you had COVID or the vaccine and all, you will have to protect yourself. Once you are COVID, you have recovered from the COVID, or you have given vaccine, you will have to protect yourself continuously by putting mask and hand washing, and you will have to avoid the crowd. That is the 3 areas actually then you will be able to protect. So still, that's a COVID is 1 year old baby actually. We have started understanding COVID last February, March. So enough document, enough research not happened so far. Still every day we are learning. Every day there is a lot of research is going on. And every day new theory is coming. But still before all those things, we'll have to protect ourselves by putting mask, hand washing, and we avoid crowd. That is the only way we'll be able to protect ourselves. We can protect ourselves, we can protect others as well.
Indila, just a moment. I have a question for Mr. Barua. If you can help me to understand, a person who has recovered from COVID, what is the time gap that he or she should give before taking the vaccine? First dose or second dose, whatever.
Initially, it was 1.5 months, 2 months. Now, yesterday, there is a notification that they are saying 6 months after you have infected. Recovery. So infection taken place one day. So earlier it was out of the when you have recovered from there, you can manage is in 4 to 6 weeks. But now the recent your notification we have received yesterday from the central government health ministry, they are talking about 6 months. So before that, you should not go for. Once you recover from COVID, the reason for that, you have antibody within you. So unnecessarily, you should not disturb your body, giving further antibody, producing antibody through vaccine. So let it be little bit fade out. There's your vaccine, your antibody, and then again you push external antibody so that you can be fit. That is maybe.
But Mr. Barua, on a layman's point of view, there are various different types of strains coming in. So
Yes.
the strain that he had earlier might be different from the ongoing things.
Right in that way. So better to get vaccinated, I think, between 2 to 3 months time. Better to get vaccinated. In maybe 2 months time, it's better to get vaccinated. So there are a lot of research is going on, but safe side, you'll have to keep yourself safe side. So 2 months, after 2 months, you can go for vaccination.
Okay. Thank you. Yes, Nivedita.
Yes, Mr. Arup Dash, we have a question from him. Which COVID vaccines have been developed in India and which is the most effective?
See,
this is a very.
I have not a doctor.
This is not a question. This is everybody, anybody who reads the newspaper. Who is this? Is this our student? Who is given this question? Which COVID vaccine has been developed in India? What are you talking? Don't you read newspapers? Both
yes.
Covishield and Covaxin. Covishield is from the Serum Institutes of Pune, which is Poonawalla, other Poonawalla, and the Covaxin is by the other bio. What is AstraZeneca or something. And then third one, which Rupak was mentioning, is that the Sputnik V, which is coming from Russia.
Sputnik V is a Russian.
Then there are several others vaccines are also on the line. One is from Zydus Cadila with all the dosages, everything. Please go to Google. Please go to Google and find out. This is not a question for our. And if you are a student, I would like to tell you that you should do your homework properly and you should know what questions to ask.
Okay, we have another question from Ritoban Mojumdar. He's saying that auditing the usage of oxygen efficiently and by providing lesser levels of oxygen to critical COVID patients to raise their oxygen saturation level to barely 90 or lower. The medical personnel say that this actually helps the patients more than if their oxygen saturation was raised to 98 to 99. Is this true?
So this is true or false, that I'm not very sure. But one thing, I don't know what exactly he is asking, but I can say one thing, that is your oxygen consumption. I think maybe he is asking about whether there is what is the percentage of oxygen is required to maintain the saturation of 98. And what we see sometimes, that is the wastage of sometimes happened oxygen is required is maybe 6 liters, but maybe we are giving 10 liters. If you can see that with the 6 liters of oxygen, you are reaching to 98% of saturation, then what is the need of giving this your 10 liters of oxygen? Because oxygen is a very crisis and is a very scarce commodity right now. So the doctors and the nurses actually are there in the ward managing the patient. They will have to be a little bit more careful and see that the oxygen level used by external your devices and the intake by the patient, whether it is matching or not, so that the optimum saturation the patient can maintain and with a proper kind of a supply of oxygen. So maybe that is the one part that each and every healthcare professionals should look into. In some cases, it has been observed also that there is a lot of wastage is happening. But again, it depends on the healthcare, how they are managing, how they are monitoring the oxygen level, how they are monitoring the supply. All those things is it's a very elaborate.
Yes, thank you, Agnimitra. One of my students has prompted me. The other vaccine manufacturer, whose name was not coming to me, is Bharat Biotech. which
Bharat
makes
Biotech.
this
I think
Covaxin.
our Intel
Bharat Biotech.
company.
Thank you,
Bharat
thank you, Agni. Thank you, Agni Mitra. Well, our students are smart. Chalo, then anything else?
I
Anything
think
else,
that
Avindila?
that is no. That is the. I think those were the last set of questions.
Rupak can't thank you enough. Really can't thank you enough, Rupak. This is too much. Fantastic.
My
You
pleasure.
took so much of time. And you are still in the office. God knows when you will go home.
And
God
Mr.
knows when you
Barua
will
has
come
been
in
very
the morning.
patiently.
In spite of that,
Mr.
this is
Shantanu
fitness.
Das?
This is
Shantanu
fitness.
Das,
This
Mr.
is
Barua has been
both.
very.
This
But
is
I
both
think
mental and physical fitness.
yes.
This is the combination of mental and physical fitness. Thank you
He
very,
has
very
been
much.
This I
very
understand,
patiently
but-
answering to the questions.
lot.
But
for
the
so long.
formal vote of thanks to be delivered by our head. Is he here?
Yes, he's here.
So would you please ask him to?
Dr. Debraj Dauto, our head of the department, would give the formal vote of thanks.
Thank you, Mr. Barua and Dr. Roy. Our students have learned a lot of things. We have also learned a lot of things, time management, and as you are talking about how to go for multitasking, resilience, how to involve your workforce. So we have learned a lot of things. And obviously, must thank Professor Shantanu Roy. Sir, you are a source of inspiration, as you've mentioned, that we always look forward to you, the kind of zeal, both in terms of physical and emotional. You're there. I also must thank Dr. Ratan Khashnamesh and also Honorable Vice Chancellor, sir, for having given such wonderful opening remarks, which actually has set the context of the whole discussion. I must also thank Madam Meena Bose and Madam Mohinjula Mukherjee to have created such a nice platform, and also Mr. Himadri Ghosh to have given such a great IT support. And we are really, really thankful to all of you. And at the last, I must thank all the people who have attended this session, especially students. I can also some of my colleagues. It's really wonderful. This is evening and it's off day, it's a holiday, but still so many students have joined this session. They have asked some very good questions, and I'm really feeling very proud because of my students. So this is from my end, and over to you, Madam Mohinjula Mukherjee.
Mr. Barua, once the pandemic is over, which we hope to happen very soon, this is an advance invitation to you to please come and visit our university. Right now, the students are not coming, but
you don't worry. I'll drag him. Don't worry. Don't worry.
We have a lovely department of School of Nursing, where we have a huge number of students. So they would definitely
enough for your information. We are already negotiating with them, and our registrar and I, we have visited. We have written to them, and it is in an advanced stage of negotiation. Very a collaborative venture between SNU and AMRI. The proposal registrar and I, we had visited, and we had sent the proposal. We are not only nursing, we are going for a wide range collaboration in the health area with AMRI hospitals. That's being contemplated. You'll be very glad. Everybody would be very glad.
Wonderful news. Wonderful news. Now there's a ray of hope.
Visit your
definitely
one day.
Okay.
Thank you.
Thank you so much.
Thank you so much. Thank you.
Professor Khashnamesh, can we close the session now?
Yes.
Okay.
Thank you very much.
Thank you for giving me an opportunity. Thank you.
Thank you so much. Thank you, Mr. Barua.
Really, really, really fantastic, Rupak. Thank you so much. I don't have words to thank you.
No, my pleasure.
Yeah. Thank you, everybody, and take care. And I should say, everybody should stay safe and well. Thank you.
Thank you.
Thank you, Indila and Shantanu, in spite of your limited energy levels, but I don't find any limitation. Of course, both of you are quite energetic. Thank you.